Hello, everyone, and welcome to the first week of, or the first day of WeRPN's Nursing Week happenings. There's lots of interesting things happening this week, and I'm so glad that you could join us. I want to begin by acknowledging that while we are meeting today virtually, we are all located on the traditional territory of Indigenous people dating back countless of generations. I want to show my respect for their contributions and recognize the role of treaty in making what is now Ontario. Hundreds of years after the first treaties were signed, they are still relevant today. Every year, Nursing Week gives us a chance to come together and celebrate our amazing nursing profession. This past year has been incredibly difficult for nurses across Ontario, and there is no one on this webinar tonight that doesn't know that. On behalf of Ontarians everywhere, we want to take the opportunity to express our deepest gratitude for the sacrifices you're making every day to keep us safe. This year, we are hosting a series of events that are virtual and are open to all nurses. Any type of nurse who work in any sector are all welcome to be here with us all week. Each of our days will focus on a theme that is central to promoting the elements of self-care and wellness. And today's theme is review, because while we often talk about during Nursing Week what our current reality is and what we're looking forward to in the future, I think it's really important that we start off this week looking through what we've been through in a week that is unprecedented in my 42 years of nursing now, and I'm sure in most of your nursing careers. So to kick off the day, we have a short video we wanted to share from the RPN community.
So, looking back on the past year, I don't know if there's one feeling that comes to mind. I have had moments of anger and fear.
Loneliness. I'm really missing a lot of people.
Exhaustion. Yeah, we're pretty tired. I can tell you that.
The feeling of languish. You're just in this mid-zone that you just kind of stay there.
Feeling that comes to mind is one of anxiety.
Fear, anxiety, fear of being sick.
Kind of feels like a Hollywood movie we're living.
I am tearing up right now thinking about this past year. I think resilience is, I just didn't realize how resilient I was.
Thank you to all the nurses who shared their thoughts and perspectives with us. We have really valued your descriptions of what you've been through. We've learned from them. And I just want to give a few remarks of my own to let you know what we're thinking about at WeRPN. As we kick off Nursing Week this year, I would like to admit that it's hard to find the words. How can you articulate a year that was, to all of you, resilient, courageous, incredible nurses? You have lived it. What could we possibly add to what you've told us? I was a nurse on the front line during the SARS outbreak, and I experienced the urgency and danger posed firsthand. But what we've seen this past year is far beyond what anyone could have prepared for. As nurses, we're conditioned to run towards a crisis, run towards danger. We very rarely think about those sorts of things because we're so busy using our education to think about the next step. We have a conditioned way of thinking about what needs to happen next. The adrenaline comes later, but we have a very conditioned way, an educated way of approaching these things. We are no strangers to stress, volatility, tragedy, violence, and dealing with the unknown. But nothing could have prepared me to deal with the physical, emotional, and psychological toll that this pandemic has taken, both on all of us personally, but especially you as nurses. Earlier this year, we reached out to our RPN community to hear from you about the impact the past year has been having, and the stories were really disheartening, even if they weren't surprising. I know so many of you have given to this profession more than you ever thought was possible. You've made tremendous personal sacrifices, whether it's been time away from family or having to see your livelihood impacted financially and otherwise. And you've managed in a beautiful way to take it one day at a time, in a way that allows you to go into work the next day and continue on doing what we need for you to do to keep us safe and to help us move past this pandemic. Sorry, I was just thinking about your the nurses that I know and the days that they've gone in when they didn't think they could, and the days some of you have told me about where on your drive home you thought, I'm not going in tomorrow, I can't do it, and somehow the next morning you got up. And so many of you have shared those stories with us. It's been incredibly important to us. Many of you have gotten sick, and some continue to face symptoms after months have passed. We've talked to members of our RPN family who are still dealing with the problems that they have had as a result of the disease, and it'll come to as a surprise to no one that we want to mention again. The people that we've lost, the nurses, 3 RPNs that we've lost, and countless other important PSWs, RNs, and people that we provide care alongside every day. It's been extremely difficult, and I think it's important to recognize the tremendous impact each and every one of you has had. Take a moment to consider what this pandemic would have looked like without nurses like you. I think we don't spend enough time thinking about what that would have looked like, because it's very hard. It's actually hard to even consider because you're the backbone of our healthcare system. But if you think about it, what would long-term care have looked like if you hadn't shown up every day to help our elderly be clean and fed and breathe as easily as possible, some during the end stages of this disease? If you hadn't been there, the tragedy of the loss of life would have been compounded by the loss of dignity and comfort and just basic necessities of life. Incredibly important. What if you weren't there to ensure that home care patients got the care that they need? The wound treatment, what would have happened to those wounds if you'd said, we can't go in there? What would have happened to the people who were so isolated and couldn't go out for care, or were terrified to go out for care if the home care nurses weren't going in there? What would have happened if the acute care nurses, be it RNs, RPNs, anyone, what would have happened if they hadn't been willing to be deployed, been willing to take care of patients that they hadn't seen before, be willing to work in an environment that you were unsure if your patients even had the disease or that you had the right equipment to protect yourself? There would have been a spread of the disease that was so rapid that we would have had far more cases. This is a disease, just like SARS, that will be managed and stopped by nurses, in particular practical nurses, in so many ways. I don't even like to think of what the death rate would have been if you hadn't been there. I know it would have been very high. We've seen what happens to our sickest acute care patients if you don't show up to work. We've also seen what happens to nurses if they try to show up for work when they're sick, or when they are mentally unable to take one more shift. And of course, we have to help nurses in those situations so that they can stay home and heal. Important work that all of us do in order to make the system work. There are nurses who work in our primary care who've tried to keep the normal care going. RPNs who work taking care of patients in a primary care setting where they're trying to make sure the normal cancer screenings and those sorts of things happen. That's incredibly important as well. Otherwise, we're going to face some very difficult days after it's over. And what if you weren't part of the vaccination teams? We are doing upwards of 100 and 40 to 150 immunizations a day now. Those numbers represent about 1% of the Ontario population every day. And many, many of those injections are given by practical nurses. I had a nurse, say a nurse leader in Ontario, say happy nursing week to me today and tell me that yesterday she got her immunization from an RPN. And there's an incredible amount of gratitude for the fact that this is your work, that you've made such a difference, because it is immunizations that will take us out of this. I'm happy to let you know that today the government announced that we can start giving second doses to healthcare providers who haven't yet received that. Most importantly, I want to recognize that the world would not be an okay place if you weren't there to support each other. You know, the support that nurses give each other when they're part of a team, when they work in close proximity to each other. And I see it on social media when people congratulate people, thank people, ask if people are okay. This is all the important things that we do. And a world without nurses is very, very bleak. So I think this year, rather than celebrating the wonderful things that you do, I think we have to recognize that you are basically holding a society together with what your contributions are. There's a well-known saying that when it comes to life, the critical thing to remember is not to take things for granted, but to take them with gratitude. And I think that's the main lesson that I've learned from this pandemic. So here are the things that I'm grateful for. I'm grateful to each and every one of you. You have shown the world that nursing is not for the faint of heart. It is definitely not for those who seek glory. It is about showing up to work even when you are at the breaking point. It is about the will to manage through the day because your patients and clients need you. It's such a strong motivator for nurses. It's doing your duty and taking on extra shifts, knowing fully that there is no help on the way because your resources are stretched thin. And nursing is about kindness, patience, strength, and competence. One of my concerns is that people don't understand the implications, not just for patients, but for you when you are working shorthanded and you have more than your normal complement of patients. I'm going to work really hard this week to try and make people aware of what that looks like for you. And I'm aware of the risks and challenges that you face every day as you leave for work. And I know the steep price you continue to pay as you shoulder those increasing workloads without wage equity or emotional supports. I know your anger and frustration. I know all of this because you have told me, and I am thankful for that. Whenever I am invited to sit at a government table with other stakeholders and asked for input on a policy or plan, I make it a priority to share your stories, and I hope that you will continue to share those with me. Like you, I'm eager to see the end of this. I am a mother and a grandmother, and I can't wait for the day when we can celebrate birthdays and anniversaries, cheer on our sports teams, go to concerts, plays, and movies. Mostly, I'm really excited to get all of my 3 grandchildren under one roof. And I want you to know that I'm seeing light at the end of the tunnel. The committees that I sit on at the government level and the interactions that I have with the pandemic teams in Ontario, I can see that with the vaccinations going up and the third wave coming down, there is light at the end of the tunnel, and we are going to get a break. And I'm just hoping that all of you make it to that point fine, okay. And I can't wait to meet you all, hopefully soon and in person. This is a week for me when I don't get to go out and go to you, but rather we ask you to come to us virtually. I want to come and thank each and every one of you for your patience and perseverance. It's been, I think if we would have been told a while ago that this was going to last as long as it lasts, I think that we would have probably been afraid. I think we probably would have been paralyzed by fear, but taking it one day at a time is what's gotten us through. So I see hope and I see light. And science will save the day. Make no mistake, science is what's going to get us out of this, and your knowledgeable application of science. I'm confident that vaccines will take us through, and it will be nurses who lead us safely to the other side, just like it was during SARS, a much shorter-lived event that touched somewhat fewer of us. But it was nurses who saved the day through that, and it will be nurses that take us through this pandemic. So now I'm thrilled to have the opportunity to speak to several members of our RPN community about the amazing work that they've been doing over the past year. We hope that you find their stories as interesting as we do. None of their stories are more interesting than your actual own stories. So keep sharing those with us. But tonight we want to share these stories with you. I am going to introduce this main event and our speakers for the panel. I first of all want to thank them for joining us this evening and helping us understand their experiences a little more. We can all learn so much from each other. So I will do a little introduction here. First of all, we have Debora Bowie. She has been a registered practical nurse at Ontario Shores Mental Health Sciences for the last 30 years, where she's worked in neuropsychology, pediatric rehabilitation, and presently she's working in complex psychiatric care. She represents Region 6 on WeRPN's board of directors and is a member of the Mental Health Special Interest Group of WeRPN. She is a member of Ontario Shores Centre for Mental Health Sciences Workplace Safety Committee, and I hope she tells us a bit about that because that's an interesting story. She also has developed the role of workplace champion to act as an educator, mentor, and advisor on the issues of violence and bullying to all staff. Debora considers herself a transformational leader, a lot more than just you, Debora. Consider yourself that. I certainly consider yourself that. A nurse who takes risks and is creative in thought and strongly committed to professional role advocacy and influence, as well as safe and effective nursing care. I often turn to Debora when I have questions about mental health, bullying, or violence in the workplace. She's a very knowledgeable person. Next, we have Adel Coulter. In her 15 years experience as a registered practical nurse, Adel has achieved several noteworthy professional and personal accomplishments. Adel has spent the last 7 years of her career at a rural Ontario public health unit. Her work there focuses on reportable infectious diseases, outbreak management, infection prevention and control activities, IPAC, assessment, investigation, and consultation in a variety of healthcare and non-healthcare settings. And I'm sure Adele never thought she'd be as busy as she is during this past year. In 2015, she completed her certificate in infection prevention and control through the Certification Board of Infection Control, and it continues to maintain that. Adele is the acting chapter president for her local IPAC Canada chapter. When she's not working, Adele enjoys spending time with her family. April Preisentanz. April, I probably said that wrong, but please correct me. April is an Indigenous nurse registered to the Deer Lake First Nations, and she was born and raised in Kenora. She has been working at Wasaji, Zignananda, Ig Amig. I'm taking my time with this because it's really important to me that I say it right if possible. An Access Care Center, WinHack, since her graduation in 2007. At WinHack, April provides primary care to 10 First Nations communities and urban Indigenous and Métis people. Métis people. They do by means of driving, boating, and occasionally flying into those communities. April has had many opportunities to obtain additional competencies throughout her career and considers herself fortunate to work for an organization that is forward-thinking and supportive of all nurses working to full scope. Last year, April took on the role of interprofessional team coordinator to provide direct supervision for 2 care teams, coordinating service delivery at the community and urban locations. She also helped coordinate mobile COVID-19 testing teams, and more recently, the COVID-19 vaccine clinics Incredibly important work, April. April says, while 2020 was a year of great challenge and change, her experience as a nurse prepared her to take on the new journey with confidence. When she is not working, April and her family enjoy hunting, fishing, and snowmobiling in her beautiful community. And finally, we have Linda Vu, who is a passionate RPN and driven to make a difference in the lives of her patients. She is currently working with the Waterloo Public Health, where she has been part of the COVID-19 response and has worked at the Recovery Center. She remains committed to supporting vulnerable members of the community who are COVID positive. Prior to her role, Linda enjoyed working in oncology, palliative care, and held several different leadership roles for several years. She believes in the importance of teamwork and the need to recognize the work of all care providers. By the way, that's also very important to us, and we're so happy to hear about that. She is happy to use her scope of practice as an RPN to work alongside her colleagues and others to fight against the pandemic. This past year has put new demands on nurses, and she is embracing all the new challenges that come her way. And her approach is inspired by a quote from the Dalai Lama, who said, "Be kind whenever possible, and it is always possible." I really love that. So what we're going to do is we're going to ask a variety of questions to our panelists, and they will share their stories with us. And like me, I hope that you learn so much from their stories. So I'd like to start by asking you all to tell me a little bit about your journey in nursing and your current role. And we can start with Debora.
Thank you, Diane, and welcome everyone. It's a pleasure to be here with you this evening. I graduated from Durham College in 1991, 30 years ago already. It's hard to believe. So I'm coming close to the end of my career. I worked briefly in long-term care before starting at what was then called Whitby Psychiatric Hospital, and having worked in neuropsychiatry, psych rehab, and currently in complex psychiatry. My interest that I have mostly in this area of healthcare lies with schizophrenia and acute psychosis. And as Diane mentioned, I'm a member of WeRPN's mental health special interest group, as well as I'm a grief and bereavement educator. And I proudly represent the RPNs of Region 6 on the board of directors of WeRPN. Thank you.
Thanks. Adel, why don't you tell us a little bit about your story in nursing?
Sounds great. Thank you so much for having me. I really appreciate it. I find this quite an honor actually to be able to speak to some of my colleagues that I haven't actually met, but one day hope to. I went into nursing to try and make a positive difference just from past experiences with my own family. And when I started practicing, I started in a family practice here in Grey Bruce and worked beside some fantastic physicians, learned a lot, and they taught me a lot. However, it just didn't seem like it was quite enough for me. I wasn't growing in my career. It was kind of stagnant. So when the opportunity came, I took the challenge and moved to the Grey Bruce Health Unit. Little did I know what I was getting myself into. I will say that much. I learned a lot, and I continue to learn a lot. My role at the health unit has evolved over the last 7 years. And has included anything from infectious diseases to infection prevention control, outbreak management, and more recently involvement with other activities with COVID-19. So it's been quite a challenge over the years, and the greatest accomplishment I've had was to achieve my CIC through the Certification Board of Infection Control. There are very few RPNs that have gone down this road, but I would strongly encourage you to do so if you haven't thought of doing that. And I look forward to chatting further today.
Wonderful, wonderful, Adel. And I moved here from Grey Bruce, and I love that area. So I'm so glad that we have someone representing that area here. We'll move on to April. April, why don't you tell us about your very unique position that you have and how you got there?
Hello, everyone. Thanks for having me tonight. I also really appreciate the opportunity to speak to my colleagues and represent RPNs across the province. My position is an interesting position. When I graduated from Conn College in 2007, I actually did a placement with WinHack, and I was just blown away by the work that they were doing, even back then, with a much smaller team. So I was the first RPN to be put on staff to provide nursing services, starting very slow and building up with some different skills. So things like venipuncture. I was fortunate enough to come down to Hamilton and get skill building in well woman exams, which was pretty unheard of, especially in this area, to have an RPN doing that skill on behalf of the providers. I've taken a variety of wound care courses. Most recently, we also were fortunate enough to travel to Louisiana and take some hands-on training for contact casting for the prevention and treatment of diabetic foot ulcers. Wow. So I definitely consider myself very lucky and fortunate to have had the opportunities I've had so far. As Dianne mentioned, last year I did take on a role as interprofessional team coordinator. So I'm much less hands-on than I'm used to, which is a little struggle for myself. But I'm working behind the scenes, making sure that things are going as they need to and supporting the nurses on our teams to make sure that they're safe and coming back home to their families safely as well. Yeah, thank you.
Thank you for that, April. Really important work right now. And, you know, the difference that you're making in your communities are very impressive. Thank you for that. Linda, tell us a little bit about your story.
Good evening, everyone. Thank you so much, Dianne, for having us today. And thank you to my colleagues and the other fellow panelists for joining me today. I started nursing back in 2013 after I graduated from Canada College. Prior to that, I graduated McMaster for gerontology and health studies. I've always said nursing chose me as a immigrant and a refugee coming to Canada when I was 6 years old. I really appreciate how much the community have helped my family and I. And during this pandemic, this time last year, I was working at the COVID recovery site. And I was very, very fortunate to work with those who are also refugees, newcomers, and those who are homeless, who are COVID positive. So we worked with the interprofessional team, including doctors, RPNs, RNs. We have psych, social workers, peers. It was a great experience. And as mentioned, I've held many leadership roles, and I was very fortunate to be part of the Canadian Nurses Association for the gerontology certification. My passion is with seniors at this time with the pandemic. As my other colleagues can contest, we are redeployed in different roles, and now I'm more hands-on, and I love doing what I'm doing, especially with the region of Waterloo Public Health. So nursing is day to day, and thank you for having me.
Thank you, Linda. So we can see that we've got a really wide range of RPNs here for us today. There's some underlying similarities for sure, and it's that deep sense of caring that all of you have, and you can't miss it in any of your stories. But what I want to know is from each of you, what has impacted your practice most from day to day? Debora, when it comes to your mental health position and where you work at Ontario Shores, what has been the biggest impact, but also personally, if it's had some impact there?
Yeah, I don't think I could really specifically pinpoint one specific thing, but a couple are just earlier on in the pandemic, the frequent changes with government, organizational, and community directives. That was very, very challenging to be able to communicate this to our patients who maybe have difficulty understanding our policies and directives anyways, as well as their families, because they'd call in one day, the next day it's a different directive. And then that was very, very difficult to try and continue to advocate and communicate that. Also, the difficulties even before the pandemic in mental health is housing. Housing is one great obstacle and challenge. And now that's even posing even more difficulties now to provide safe housing, because of course we work with people who live in the shelter system, in the group home systems as well, communal living in these areas too, that sometimes are not, the standards aren't being maintained or overlooked, and there's a lot of movement in between these facilities. Personally, I feel the biggest impact is the need to identify and strongly advocate for the nursing role like no other, like we've never. I mean, I go on about advocating all the time, but I think this is a time when we don't have a choice. It's very easy to get caught up into the misinformation, the fear, the confusion, the frustration, which can result in complacency, and therefore feeling defeated, becoming detached, and asking why bother? Why am I bothering with this anymore? And possibly leaving the profession, as we've seen some people do.
Right.
So those are some of the challenges that I experience on the front line.
Yeah, incredibly important. And I would imagine with your patient population, the challenge of changing directives, particularly in the beginning, would be incredibly hard to cope with that sort of thing. So thank you for that. April, what about you? What would you say is your biggest impact to your practice?
Well, number one was that I had actually been removed from direct practice. But we faced similar situations in primary care in terms of what we were allowed and not allowed to do with our clients. So in the beginning, when we had to switch to virtual care, that was a huge learning curve for not only our providers, but definitely the population that we serve as well. We have a lot of people that still face issues with access to phones, internet, and any kind of technology that can help them get in touch with us. So that was a pretty big barrier to care in the beginning. And redeployment was a huge change for many of our providers. Because we weren't seeing as many people in person, and because a lot of our RPNs do hands-on care, we had to find alternate assignments for them in the beginning. And then we slowly started to bring them back for different types of redeployment. So as I'd mentioned, we started to do the mobile COVID-19 testing for our First Nations communities. Our teams would go out and take swabs from our central assessment center, go to the communities, swab as many people as they needed to in a day, bring them back. And that was their new normal. When we had our first actual positive on reserve, I'll never forget it. I was walking out of Walmart, and it was about 5 o'clock on a Friday. And I thought, this is it. Like, I feel like we're kind of getting past it. Things are starting to slow down. And then we got our first positive. And we had approximately 16 testing teams going steady for about 3 weeks with hardly any breaks. And that continued on in cycles throughout the summer, throughout the fall. Most recently in January, we had a very large outbreak in one of our communities, and took quite a while to get past that. So lots of RPNs being redeployed to different types of roles that they weren't used to before. We've started doing the COVID-19 vaccine clinics also for our First Nations and our urban and Métis population. So since February, I want to say that we've given approximately 2,700 vaccine doses. And last week, we're also approved by the government to start second doses for those populations as well. So we're looking at a very busy 6 weeks to try to catch everybody up that only received a single dose. So I'd say the greatest impact to our nursing is just being flexible and rolling with the changes and the demands that their job now faces. And for myself personally, I definitely felt a lot of guilt over the year for not being with my peers and my colleagues and watching them struggle and put themselves at risk and put their families at risk, knowing it was such a great need. I was so proud of them each time they went out, each time they woke up at 6 in the morning. We even had one of our nurses go out the day after she got married in a secret little backyard wedding. The dedication that our teams, not only our nursing, but our support staff as well. We have lots of members of our interprofessional teams that support the testing and vaccine clinics. So we have health promoters and emotional wellness workers, dental hygienists, health coaches, just to name a few. I'm sure I'm missing some people in there, but we have come together as a team, and it has been so uplifting to see and experience that it makes it a little easier to get over the guilt of not being there right beside them. I meant to actually have somebody pull up a thing on the screen there just to show off some of the pictures from the last year. Just the next one. I was also supposed to show that one too as part of my journey to nursing, but that's okay. So here in the pictures, there's a variety of images you're gonna see. The red suits, those are the suits that our COVID-19 testing teams have worn out to community for the last year. Weekends, stat holidays, children's birthdays, what have you, they've gone and they've done the job. You can see that there are pictures of them going by helicopter. There are pictures of drive-through HbA1c testing. It's just so much. It's so overwhelming to see everything that they've done over the last year. Social distancing, fish fries that we did in the fall to try to get back into our communities and remind them that we're not just there for COVID testing, we're there to support their needs and remind them that real life is important as well. So I did highlight on there too that we have completed 3,568 COVID tests as well. So.
April, that is amazing. And I will tell you, and the RPNs who don't know this, the most common thing said to me by nursing leaders, RNs, RPNs, all of them, is the guilt they're feeling as they witness the nurses who provide the hands-on care, and the fact that we are not part of that. We have to support in other ways, and nurses feel a guilt with that, and which probably doesn't make any sense, but it's very real. And thank you for demonstrating that for us. It's just a really important thing that we need to recognize, that there's people who whose jobs aren't in direct patient care that have a huge impact that still feel the pull to the patients. And that's exactly what I was saying earlier about how we run to the danger. You're a great example of that, April. Adele, why don't you tell us what the biggest impact the pandemic has had on you?
Well, just listening to Debora and April, we're probably those people that keep sending you things that you have to change, directives and notes and memos and all those sorts of things. And to be truthful, we've had to try and maneuver those just as quickly as you have. In some cases, we receive them the same day as you do. So that's been a bit of a challenge as we've gone through. But so many aspects of your work, I see the impacts on the back end, I guess you could say, or the front end, I'm not sure which one, from the aspects of public health. I certainly have seen a high demand of on myself. I am the only CIC certified person at our health unit, so they do, it has put a lot of extra pressure on myself. But on a positive point, from an impact point of view, I would say that my skills are being recognized. And I, as an RPN, am being recognized for what I'm capable of doing, instead of constantly being pushed the opposite direction. I'm now being pulled into where I'm more than capable of practicing, which has been a positive. If there is a silver lining, that's been there. So I would say that one of the things in my practice is a lot of the times we've focused a lot on healthcare, and long-term care has been a really large component of that. But with that, from my end, I've been pulled in so many directions. My lens for IPAC has been broadened and stretched so thin, but it's been interesting because it goes outside of healthcare settings. It goes into other settings like your shelters. It goes into childcare settings in schools, and even into workplaces. So from a public health perspective, it's not just about healthcare and patients, it's also about our community and how we can help through that point of view. So, I think that's the biggest impact, is trying to spread it out, prioritizing what we need to do first, and knowing who's doing what, and also realizing that, you sometimes speak a language. So I speak IPAC language and I get going, and I forget that the person I'm talking to has no clue what IPAC means. I had a work colleague say that to me the other day, who is helping out at some of our vaccination clinics. She says, I'm more than willing to help you. But I had to Google what IPAC was. And I thought, oh my goodness, what have I done? So it's foreign to some people. So I really need to sometimes take a step back and think about those things when I'm talking to, say, a childcare center, or a shelter or a congregate setting. And more recently, we've been talking with workplaces, so our Chamber of Commerce, because we're wanting to get some information out there to the workplaces to help decrease spread in workplaces. And some of them are also starting to look at rapid testing for workplaces. But here we are sending out testing kits to non-medical professionals, and expecting them to take a test, interpret a test, and know where to go from here. So, I think for myself, there's been positive impacts all around. A negative impact, I would probably say for myself, is that guilt, knowing what our front line have gone through, and knowing that I'm not on that front line the same way as some of you have been, and those that are listening. I hear the stories, working with outbreak response in long-term care homes, and short staffing and trying to work through things. And we're telling you, you need to do this thing, you need to cohort, you need to do this, you need to do that, and yet the staffing isn't there to be able to do that. So there's best practice and then there's real life. So I think the guilt on my end to not be on the front line, I would agree with you, April. It's a little difficult sometimes, but also taking a step back and realizing that you have to have all parts of the chain for the chain to keep going. So yeah, I've had some positives and some negatives, but overall it's been a very interesting experience.
And I think it may come to a surprise to a lot of people out there that we have such an accomplished RPN working on the issues of infection control. So I'm so glad that you are able to share us with that with us today. Linda, what about you? What has had the biggest impact on you through the pandemic?
The biggest impact was, I recall last year, just working with short staff. Colleagues were getting sick, and day to day, I think 1 month I worked over 280 hours, but you just get ready and just know that you're making a difference in someone's life, and your patients are waiting. And those that are COVID positive, they are experiencing, all these symptoms, and you're there to hold their hands, to be their comfort. More so, I believe the first 4 months, I wasn't able to see my parents, my family. And during this time, I also was COVID positive. So that have impacted my practice. It impacted my perspective with empathy and compassion, because I realized what my patients were going through. It was a scary time with IPAC measures, as Adele have shared. It's go day to day with the medical directives, and but I'm very lucky to have supportive peers, my colleagues, my team, and my family to always be there to cheer me on, to know that I'm making a difference. And with the gratitude of the community, it gives me the strength to help me in my day-to-day practice.
Thanks, Linda. Such an important contribution. April, I'd like to know from you, what is the biggest lesson you've learned through this time?
I guess based on everything that we've said, it's learning to be gentle with yourself and to understand that we're all going through it as well. We might not all be on the front lines, but our peers are, and our relatives are, and people from our community are. And as long as we're all doing what we can to support them, to make sure that they're going home to their families in a safe way, I think it's important for us to be gentle with ourselves and know that we are also contributing. I think that's a hard thing for any nurse anyway, because of the type of people that we are.
I think, April, I know, and my staff would probably agree with me. Look, I'm having a little cry with you here, but there are days when I feel like we haven't done enough. We try every day. We listen to nurses, we take action every day. And there are days when we just break down because we know what everybody's going through and we haven't done enough. So I know what that's like. Adele, what would you say is the biggest learning you've had? Because you're right in there with the infection control.
I think April hit the nail on the head there, right? You're totally right from that point of view. Lessons from my side, there's so many. No, I just think that I think the biggest lesson that I have is probably the continuing to advocate for ourselves. Advocacy is sometimes will pay off, or it will pay off at some point. I've been advocating for this role for the last 7 years since I've been at the health unit. And finally, I'm getting the recognition of what the role is possible and what it can be. And so, the lesson is if you believe in it, drive towards it, because you can do it. It is possible. So don't give up on those things that you believe in. I think that would probably be the biggest lesson as it's gone through. It's been a long road to get to this point, and it's too bad that we've had to go through a pandemic for it to be recognized, unfortunately. And I'm sure we see that in other settings as well, because we've had to step up and do things that we haven't had to do in the past, because there hasn't been anybody else to do it. So I think once this pandemic is over, I think there'll be a lot of different settings that are reevaluating what we as RPNs can and do bring to our organizations.
The past year, thank you for that. But the past year has had this tremendous toll on all of us. And Linda, can you tell me what strategies you have used to cope with the additional stresses you're facing and the challenges you may be experiencing?
One of the strategies I always try to use is to remember kindness, and gratitude is very vital. I walk in regardless of the day-to-day, what was the past, just celebrate the small wins with my team. Could be, the patient, after they recovered, they leave and they're so grateful for us. And we do the cheers and we're very celebratory of the small wins. And also just being kind to myself, knowing that we are trying our best. It's only 24 hours in a day. And if I can take time to be in nature, go for a run, just be by water, it's really, really therapeutic in that way. And know that when you just need the strength of many, and sometimes what you're going through, what you feel that you cannot cope, perhaps you can talk to your peers, your supervisor, or just sometimes it's not even words. You just have that look and you understand that this is a really hard time for everybody. The patience, the strength that you need to carry is with many. And that has been one of my strategies, is to help keep going and to know there's light at the end of this.
And there sure is. Debora, what does the mental health nurse do to cope with the additional stresses and issues that they're facing through a time like this? What would your answer to that be?
What I hear day to day is the constant conversations about COVID and the impact I think that has on our psyche. If that's all we're engaging about, if this is all we're talking about. And I think that's why it's important, to reach out to the people who are not your colleagues, who do not want to talk about COVID with you, who, can help take you away from those distractions that we have every single day. They're on the TV, the statistics are on the TV, everything. And I think pulling back from that and saying to someone, let's talk about something else. Let's talk about something else that can empower us, that can connect us to each other. Because if we're not connected, we're not able to care for each other either. And that connection doesn't necessarily need to be COVID. It doesn't necessarily need to be a pandemic. Because when this is all over with, what will that connection be that we have to each other? What is that glue that will keep us and bind us for the next challenge and as we face down the road? I think as Linda had mentioned and touched on in regard to the community and the outpouring of support and encouragement that they've given, I think it's important to give back to them as well in performing an act of kindness in the community, doing just something and reflecting on how that makes you feel when you do that. So whether that's paying for that coffee at Tim Hortons, whatever it may be, however you can in socially distancing, and how you feel when you do that and holding on to that. But I think reminding ourselves, especially in mental health, to stay connected to each other, build on each other's strengths, and continue to support each other.
That's really, really wise, Debora. That very, very wise. It is easy to get caught up in the discussions about the pandemics, and it continues right in our own homes. So you can take a break from that and talk about or do something different than that. So, Adel, the pandemic has shed light on some of the cracks in our healthcare system. You work in public health. It's also opened new opportunities for practices like virtual care and that sort of thing. But what is a change that you'd like to see in nursing in the years ahead?
Sure. I'd like to actually speak towards Debora's comment, if that's okay, with regards to the discussions in our houses and whatnot with regards to COVID and taking it in a different direction. And I think, obviously, I speak a lot about it at home where I'm working from home, and the sponges that live in our houses that are maybe 4, they absorb more than we think. We were driving by and there was a park that there was nobody at yesterday. So I thought, oh, well, we'll stop. Because, how often do you actually get to go to a park where there's nobody there? Anyways, a little girl showed up. She was 2.5, and she approached my daughter wanting to give her a hug. And my daughter says, whoa. And I'm like, oh gosh, what's she going to say? Because you never know what she's going to say. She says, we're not allowed to hug. It's COVID. And she just turned and walked away from this little girl. And I'm like, oh my gosh, what have I done? And I explained to my daughter, and we stopped and we talked about it, because obviously she's heard us talking about physical distancing and things like that, because even the other day she wanted to see the cows at her uncle's house. And she says, I forgot my mask, Uncle Ted, but that's okay. We can keep distance. And I'm going, what are we doing? Here's this 4-year-old who's getting messaging, obviously at daycare, but also through our own home. So it will have impacts. So Debora, I appreciate you making that comment about, it doesn't always have to be about COVID. So thank you for that. I appreciate it. And as for your question, Dianne, what are the things that I hope will carry on? Can I just say that if we were to look at the rates of influenza over the past year, they were quite low. In fact, I don't think we saw any influenza outbreaks in our facilities at all. And I think that has a lot to do with the IPAC control measures that are put in place in these homes. Now, some of these are pretty extreme, like the visitor one. I'm hoping that'll be lifted fairly soon. These elderly folks need to be able to see their families. There's so much that we've missed. But some of the other IPAC measures that our colleagues have been putting into place, they work. And I think this is evidence that it does work. I also hope that the senior leadership of your organizations take into consideration the importance of infection control and put people in those positions, those lead positions in IPAC that want to be there, that want to be champions, and are there for not only your residents and they're there for your staff and you yourselves. So I really hope that it will continue. I know we saw after SARS that Public Health Ontario created a lot of best practice documents through PIDAC, so Provincial Infectious Disease Advisory Committee. Those documents have been great. Prior to working at Public Health, I had no clue what they were. So I hope that as much as this has been a negative impact, I hope that there's been some positive attention brought to best practices in infection control, the needs for protective equipment within your centers, and the need for discussion and training so that everybody's prepared.
Thanks, Adele. I have a 4-year-old grandson, and he cried one day. He cried and said, because there was germs everywhere. It was impacting what he could do. And he cried and said, can't we just use a mop? So it is very, very hard for our kids to understand any of this, and yet they're forced to take part in it in some ways. I love your suggestions for what we could change. Debora, what about you? You are very close to the front line in terms of providing direct care. What is some changes that you'd like to see in the years ahead?
Well, I think that anyone that knows me well enough knows that I honestly say nursing voices need to be heard. We need to be included in discussions at the tables. We need to partake in strategies. But at the same time, I don't think we need to wait to be asked to do that either, to propose an idea and a thought that you may have. Yeah. Run it by somebody that you work at. What do you think? What do you think of this? Because we all talk about these things and we all have these ideas, but we never go anywhere with it. And be aware of who is in your organization or who is within your working teams that you can actually take that to. I think two of the areas that I advocate a lot about, and I'm very passionate about, as you mentioned earlier, Dianne, violence and bullying in the workplace, along with psychological health and well-being. And there needs to be more ongoing nursing education and advocacy addressing these subjects. There's a lot of misunderstanding about the definitions of bullying and harassment and so on. So I've been thinking about this. As Dianne knows, I came to her a couple of years ago initially about this. And I proposed to my workplace the development and implementation of a champion role to increase awareness and advocacy and education. It's important, I think, to take these risks for all of us to effectively and informatively advocate for what's needed, because I do believe personally that there's always good that comes out of bad. I really do. And this pandemic gives nursing a chance to change a fragmented system in areas that we've been able to identify and work in.
Debora, you did exactly that. You saw a problem and you pushed forward with it until you were heard. And that was incredibly impressive to me, but not just to me. I was in an outlet mall in Florida and ran into Deborah's chief nursing executive. And she pulled me aside to say how proud she was of you, Debora, for insisting that this was important work and that it was important that we work on a resolution to environments that were not safe or healthy for nurses. So you practice what you preach, and you've brought about some incredible change through that. And you stand as an example to all of us who need to find the courage to move forward in an appropriate way to find some solutions to some problems. April, I want to ask you about student nurses. We have many student nurses coming into the profession, and it's a really, really challenging time for them to be joining us. So if you could give advice to a nursing student who's just joining us, what would that advice be?
I think my biggest piece of advice would be to just go for it. We brought on a nurse, a new grad nurse at the end of last summer. And I noticed on her social media today, she put up the banner that said Nurses Week, proud to be a nurse. But she also made the comment about how hard it was to start off in the nursing field during the pandemic. But she did it anyway. She saw an opportunity with our organization and she took it. And we have been nothing but floored by her progress, her willingness to dive in headfirst, and the competence that she's built over the last 8 months has been wonderful to see. And I just hope that other new nurses out there have the courage to do the same. People thought I was crazy for coming into primary care straight out of nursing school. 90% of my graduating class went straight to the hospital because that's where you go to learn your skills and to maintain them. And I knew that that wasn't going to be for me. I had a goal and I made it happen. And not everybody has the will or fight to do that off the hop, but new nurses need to, and we need to support them in those roles. The nurse that came to work for us came to us as a student as well. And it was very unfortunate that we were not able to support the long-term placement at the end of their school because of COVID. They were allowed to do the hospital, so it's not that they were without, but they didn't get the opportunities to see what other options are out there. So I love sharing my personal journey with nursing, especially with new nurses, with student nurses, because there are so many opportunities out there that doesn't involve the hospital, where you can still have great impacts in the lives of others. And we also need to support those learners and take on students and show them that there's a world beyond the hospital setting as well.
Absolutely. There is, all of us from our school days remember a nurse who embraced us when we came into the working environment, and I would hope we would all be that nurse for someone as well. Linda, tell us what your advice to to student nurses for when they graduate. What's your best advice for them?
What a tremendous time to be a nurse, and welcome to this wonderful profession. As a new grad, I know myself getting nervous. As April mentioned, you just have to get your feet wet. As Debora have mentioned previously and in the chat, I think from a novice to expert nurse, you also need great mentorship. You need to know that there's people there to support you. We're always cheering each other on. Nursing a profession for caring. We're always caring for others. And it's important to care for ourselves and care for each other, and to know that we should be continuing to support our new nurses and student nurses. Don't be afraid to ask questions. I know when I started my profession, I asked a lot of questions, and that's how I've got more involved, being with WeRPN, and I feel it's just like a sense of community, and you are always welcome, even if you're a student nurse day 1 to for nursing profession day 155. There's no silly questions, and don't be afraid to speak your mind, and always advocate for yourself.
That's a great answer to talk about the community that we get from each other. And so what I would say to student nurses is find a wonderful nurse like one of these 4 and tell them you'd love to learn from them. And that's going to serve you really well if you can find someone like that. So here we are with 4 really varied but very interesting nurses who have a lot to share. And so what we'd like is for you to take this opportunity to ask any questions that you'd like. We're going to have a Q&A. Anything you'd like to know about their experiences or their area of specialty. They all have some specialized focus that is very important in our healthcare system. So feel free to ask them questions about that, or if you have a question for WeRPN, of course, we'll take that as well. But you've got these wonderful nurses to really explore. So what we're going to have is Tiff Blair, who is one of the staff at WeRPN, the author of those newsletters that you get all of the time. She's going to take your questions, and she's going to share those with everyone to get some answers. Thanks, Tiff.
Yeah, thanks, Dianne. So you can either put any questions that you have into the chat function at the bottom that I know a lot of people have already been utilizing, which is great, or the actual, there's a Q&A button as well that you can use to ask any type of question as well. So I'll just give them a quick second there. I guess maybe while other folks are thinking of questions, one thing that I think a few of you touched on is, through the pandemic, working with some harder reach communities and some of the barriers that you face. So, April, you mentioned, working to try and get out to testing sites or providing care to people who don't have internet or, the same kind of reception. And Debora, you talked about, working with folks who may experience homelessness. What are some of the strategies that you employed to overcome those barriers?
I think for myself, it's not keeping your questions and your thoughts pertaining to it strictly within the nursing, but to reach out to your social workers, to reach out and maybe understand what the obstacles are a little bit more from their role that could help us better advocate when working with the patient from the nursing perspective. So not to see it just strictly, that bit's coming from nursing, that bit's coming from here, but to get a really well-rounded understanding of the difficulties and obstacles that are faced in the community, so that as a team, we're all communicating relatively the same way to our patients.
Yeah, very similarly, when we created our COVID-19 assessment that we do along with the swab, we had to make sure that we were addressing areas that might be uncomfortable, but were very important. So some of the questions that we did have to ask were about congregate living, whether they had the ability to isolate within the house or they would have to be removed, whether there were any substance abuse issues that could be of concern when isolating, mental health concerns or care needs that would have to be addressed also when isolating. We've had some very unfortunate situations in which fear and a lack of understanding of the disease meant that some of the community members were asked to leave their homes and isolate in town. We've had a variety of isolation centers up and running. We had a very large one in our community here in town, which timing wise wasn't great, because when fall came, they wanted to put the ice back in. It was at an arena. So they took it down before the worst of COVID actually hit our area. So we have utilized hotels where we can. We also have a healing lodge on one of our reserves that we had to use to house a family because they were asked to leave. So those were huge challenges that many of our First Nations had to face whenever they were asked to isolate. And the other thing that we had to be creative with was testing sites. So the majority of our testing in the beginning occurred outdoors because there was a fear of having us indoors and having potentially infected people indoors that in places that weren't their homes. So when the weather starts to change, because I don't know if everybody knows where Kenora, Ontario is, but it gets quite cold. So by the end of September, it was starting to get much too cold for our staff to work outside. Their hands were freezing. So we had to advocate to the communities to find us adequate locations to do that testing indoors, where we weren't around other people, where there was facilities for our staff to use. And in the communities where we weren't able to access those, we, along with another organization that we worked with, were able to access some decommissioned ambulances. And so we have testing that occurs in the back of ambulances now too in some of the communities.
Oh, that's great. Thanks so much for those answers. So I'm just noticing a few different questions coming up. So I think this one is probably for Adel. You have a couple of folks that are very interested in IPAC training. So someone asked where they can get IPAC training, and another person who I believe is a student is asking whether you have to be graduated before you can get an IPAC certificate and what the requirements for that would be. So hopefully you can shed some light there.
Sure. It's not as simple as just taking a course, to be as, I guess, putting it as bluntly as possible. So, I think the best place to start would be IPAC Canada has a great novice program that they run. So you can connect with IPAC Canada, and it's an online course. I believe there's some other courses through Queen's University that you're capable of or able to sign up for. And I believe Centennial also has a more recently a program as well. So those are programs that I've seen endorsed through IPAC Canada. I myself took the IPAC Canada novice course initially. And then from there, a lot of the resources for the exam itself through the CBIC actually are done through APIC. So it's actually American-based exam. So if you just type in APIC, American Infection Prevention and Control, I might have that wrong. I think there's epidemiology in there somewhere. Anyways, if you type in APIC, you will come up with a textbook. It's quite a large text. Generally speaking, if you reach out to your Public Health Ontario jurisdiction, so like IPAC West, for example, if you're in the West region, they can sometimes send you a copy of those to borrow. And that is a study guide that you can use to gather more information. Obviously, best practice documents through PHO are also very helpful. It's really not a simple answer, so I apologize for that. But as for the exam itself, you have to have, they do recommend that you have a minimum of 2 years experience in infection control before you can write the exam. However, if there's anybody that has actual specifics, it's probably easier for me to compile an email and send it to you than it is for me to actually tell you all of the specifics about it. So I'm more than willing to, you can share that with people, Tiff, if you want my email address, and I'd be more than happy to share that information with you.
That's awesome. Thanks so much.
Yeah.
So Mark is asking, and I think this is a kind of a question for anyone who wants to answer, is how do you see the health system coping with COVID on a yearly basis, as this is something that will likely be a yearly concern given how widely spread it is in the general population? So Linda, do you want to share some thoughts on that?
First off, I know there's other questions about the vaccine hesitancy as well. I am so happy to hear that people are, waiting to get the vaccine, and they want to, or they're working on, now the Pfizer's children that are 12 and older. This will probably be an ongoing issue, and it's going to impact our nursing practice and our role as RPNs. As all the other ladies have mentioned, I hope our scope of practice would be acknowledged and highlighted during this pandemic, and that will continue to be utilized in a lot of our capacity. As we've demonstrated in the front line during this time, and even working in leadership roles, there's many ways that we can continue to help the community. So I hope that we'll be given a chance, and also, along the line, now recognizing IPAC measures, so continued use of social distancing, face masks, but eventually one day maybe very soon we get to be united, and that as we continue to fight this pandemic.
Great, thanks Linda. Did anyone else want to share thoughts on that?
I certainly do think that they're going to see a lot of the practices that are currently in place obviously continue. Obviously, universal masking is probably going to be something that we'll see in healthcare for a while yet. And then I wouldn't be surprised if at some point here, depending on how studies go with regards to vaccinations, whether or not there would be an annual vaccination for COVID, much like the influenza vaccination. So obviously research and science will tell us more as we go along, but I really don't see us changing much of our internal practices with regards to universal masking. And, with the variants of concern currently, and if anything, you might see us add more things such as eye protection as being something that's universal as well.
Yeah, I'm seeing a lot of nodding heads there.
Yeah, I agree with that as well. Yeah, looking at the universal masking, I think that's what you're going to see in hospitals, and I think you're going to see that in the community. And as well as, like Linda had mentioned, about enhancing upon the scope of practice, looking at the true value of the role of the RPN and building on that.
Great. So Laura Lee asks, how are the PPE issues of the beginning, I assume she means sort of that we experienced at the beginning of the pandemic, working out now as we get further along into this? Did any of you have any dire supply issues?
We did. We didn't have any extra masks actually on the wards at the time. They were given to us and still continue to be given to us as we come in on our shift. If we required one, if it was soiled or, because I mean, in the nature of my work, we're talking all the time to the patients, so they break down easily. If they need to be replaced, we would have to go to somebody off the ward to get a mask replaced. However, now we do have a small supply of masks on the wards because we do accompany some patients down to the cafeteria just twice a day there and back. And of course, they have to have them as well. But they're easily readable, more easily readable to us now than what they first were.
I can speak to that too. Since I started with our organization, I've actually been responsible for all the ordering of our medical supply. And I can remember sitting with our executive director in February of 2020, talking about maybe we should start stocking up on some of these things. Like we have some things. We still had stock of N95 from H1N1. And despite manufacturer expiry dates, we held on to them and we used them for our testers. We didn't routinely use them within our clinic setting but we did make them available if they were requested by a nurse, that we were not going to say no. This is another area where I feel a bit of guilt, knowing what hospital settings went through, knowing what long-term care went through, knowing that some nurses had to use 1 mask per day. Because we are funded in a different way, we had the luxury, and I'm going to call it a luxury because it was, we could buy masks where we found masks. We could buy PPE where we found it. That's not to say that we didn't experience the price gouging that was supposed to be prevented by the government. But I did what I could to source what we needed. And I was very fortunate in finding alternate suppliers than what we were used to using. And I do have a lot of guilt that there were so many people out there on the front lines who did not have access to that, when clearly there were different avenues that places could have followed to make sure that they were keeping their staff safe. The prices, I can say, have started to come down for some things. Obviously, masks are much more attainable now. Gowns are much more attainable now. I don't know if anybody knows, but Canada has started to manufacture N95 through 3M. And we are waiting for a potential shipment of those Canadian-made ones sometime in June. So it was definitely interesting, but like I said, I did what I could to keep our staff safe. So if it meant paying ridiculous prices, we paid ridiculous prices.
Mm-hmm. I would have to say that for myself, that's one thing that I've got on my radar right now, actually. So I'm working on a broader strategy for Grey and Bruce with regards to IPAC and outreaching not just hospitals, long-term care, healthcare, but outreaching to other places. But also within that strategy, one of the categories is PPE procurement and pandemic planning. And so making sure that people start to consider, you know, what if this isn't our only pandemic in our lifetime? Truthfully speaking, I'm fairly certain that this is not what we were expecting to be our pandemic. We were expecting a influenza pandemic. So could it happen again? And if it does, what does that look like? So already just trying to look at ways of procuring PPE, but also making sure it doesn't go to waste when you talk about expiry dates, because N95s previously did not have expiration dates up until about maybe 3 years ago when they implemented the 5-year expiration date, and it's based on the elastic band that is that's there. So I too kept all of my expired N95s in my PPE pandemic supply, and we actually did send those out to places so that people could use them. At the time, people are like, why are you keeping those? It's just taking up space. I'm like, you never know if you're going to need them. Rather than somebody taking them home and using them for a paint project, they actually got dispersed to somebody that actually could use them in a true emergency situation. So I think for my own point of view, I think that's something that needs to be brought forward to senior leadership and stakeholders, that planning forward, we need to look at PPE procurement. It's not just our senior leaders at government level, it's also our organizations looking at your internal plans and process. So there's lots to do with IPAC. It's not just about what PPE to wear and or training and or all of those things. There's so many different aspects of it. And I think we're in a place now where things are going to start to settle out. I'm saying that out loud. I'm looking for the end, I think. But, you know, it's now to start planning for the next go round. So, you know, doing calculators to make sure you have enough stock on hand in the event of an outbreak. But again, how much do you need to have on hand if you were to go into an outbreak in a pandemic kind of state, right? So that is being built into my broader strategy for our local community, but I'm hoping that it's something provincially that they're going to look at too.
Thanks so much. Yeah, I think there's definitely going to be a ton of lessons learned after you know, the last year, and certainly people will be putting planning on the forefront for hopefully what won't be a future pandemic, but you know, better to be prepared.
Well, this is an opportunity. Sorry if I could cut in for a minute.
Sure.
This is an opportunity too, when we talk about communication and advocacy as well, when we attend our staff meetings, just our general staff meetings, if you will, ask for something like that to be put on the agenda. Reach out to your IPAC representative and get some information firsthand and educate and so on, and keep that conversation going through those channels as well. Not expecting it just to come from you, Adele, that IPAC person down the hall or whatever, but, reach out as nurses and communicate with them as well, and share some of that information where we can at staff meetings and that as well.
Yeah, that's great advice, Deborah. So our next question is from Amanda, who happens to be our student board member. So she asks, or she says that, currently there are very limited clinical placement opportunities for students due to COVID. So they're getting a very narrow view of what types of nursing careers are available to nurses beyond hospitals and long-term care. What would you suggest to students who want to learn more about different opportunities that exist for RPN? She says that it's been very interesting to hear about the different types of directions you've all taken.
I think certainly, representing on the board, certainly we've got a wide variety of nurses that represent different regions there as well. So we're all accessible to you. You don't have to necessarily just reach out to the person representing your region, but we're all available and you can contact us. I think I can speak on behalf of everybody, Amanda, when I think people would be more than willing to share their expertise and knowledge, and also others that they may recommend you to be able to get in touch with as well.
I don't know, I might speak out of turn here, and if I am, just say so. Maybe it's a matter of us having some kind of directory on WeRPN with our different professions that we have, and maybe it exists and I just don't know about it. So, I'd put my name forward that I have IPAC background, and so if you're looking for information, you can connect with me. And if there's other individuals, which I know there are other individuals in IPAC out there, few and far between, but there are, that we'd be more than willing to help as well. So I'm not sure if that's something that's already existing or is an option.
It's Dianne. I would think that we have several different options for people as well, be it mentorship, networking at our events like this one, and especially when we get back in person, that's the real networking. But also we feature RPNs and do profiles on RPNs on a regular basis. And if you follow our social media, if you're a member and you get our journal and those sorts of, and go to our website, you're going to see some interesting stories about RPNs and what's available.
Yeah, no, definitely. On our website, we don't have a directory, but we do have a list of sort of RPN profiles that highlights different roles that RPNs are in across all sorts of different sectors. So that's something that we have currently, and definitely I think we'd be open to the opportunities for having more touch points for people to reach out to individuals for sure. So I'm just mindful that we're coming up on 8:30. So maybe I'll just do one more question here and then pass it back to Dianne for some closing thoughts. So Renuha asks that some staff at retirement homes are hesitant to get the COVID vaccine. Where can we get the educational info which could be used to educate them?
I would probably direct that person right back to your local health unit to talk to someone in the vaccine program. And I say that because I was just recently, this morning, actually, I was at a childcare center doing an IPAC assessment, and they have about 50% of their staff that are not sure they want to have it. Mainly because they're in childbearing ages and they just don't have the answers to the questions they want. Definitely don't Dr. Google. I know we're all guilty of it, but please don't do that. I know locally from a Grey Bruce Health Unit point of view, we'd be more than happy to have that conversation one-on-one with the person so that we can actually answer any of those fears that person may have. But there are certainly specifics. I know, Dianne, you've shared those during some of your live events with regards to information on that, but speaking to a live body is sometimes what people need. And, local public healths are able to do that. It's just maybe take some time for them to get back to you is the only thing.
And I would add, for questions of this sort, I would urge all nurses to remember that we are also scientists, and the way we approach our care is always to weigh out situations and choose the less risky situation. And for example, with immunizations, the less risky situation to put yourself in is as an immunized person. When it comes to an unknown, we all of a sudden start looking for the no risk choice, and sometimes we don't have that. So as nurses, we every day help patients choose the choice of the least risk. And let's not forget how good we are at that, and do that ourselves and help others do the same.
Great. So yeah, I think Dianne, if you just want to close us off for the evening.
I would love to. And first of all, I just want to thank everyone for those great questions. I wish we could do this every night with a wide variety of people, because I learn so much every time we do that. And I want to thank all the participants that attended our first virtual Nursing Week event. Our theme today was review, and I think we've done a good job of reviewing the week. But we are going to take Debora's advice, and we're going to move away from some of our talk about COVID and do some really interesting things for the rest of the week, including educational opportunities. And tomorrow's theme is reset. We are going to have what is called a sound bath at 8:30 in the morning. Now, I don't know what that is, but I can tell you now at 9 o'clock tomorrow morning, I'll know what it is. Please join us for that, and a yoga session tomorrow night at 8 p.m. And you can be an absolute beginner to attend, because I know I'm attending. So you can be a beginner and do that. And I want you to go to WeRPN, where you can see what's on tap for the rest of the week. Some of the education sessions might be very much exactly what you're looking for. And I just want to wish you a happy Nursing Week, one that is filled with gratitude for what you do. And reflect on whatever is positive in your life, whether it's each other or whether it's the difference that you've made in people's lives this past year. Thank you all so much for attending, and I'll see you tomorrow.